Well, and Kim Lewis now joins me to tell us more about her visit to Liberia. Kim, welcome to Africa 54.
Thank you, Vincent.
Nice piece there.
Thank you.
How are the Carter Center's other mental health programs helping in other sectors of society in Liberia?
Well, I've had the opportunity to visit several places to see how people are really benefiting from learning really what mental health is and how to get treated if they need it. And one of those organizations is the Cultivation for Users' Hope. And it's really special because the patients actually run this organization. The president and the vice president both suffer from bipolar disorder. And I was able to speak with both of them just to find out really, going into their background to find out really how they came about to find out what was wrong with them. And they said after they received the treatment, after they got the diagnosis and the treatment, they were able to turn their lives around and to be able to help others. And the majority of the staff, they're in Monrovia, are also patients dealing with various bipolar disorders.
And in a country that has gone through so much trauma, we think about the young ones. How are schools particularly benefiting from this?
Well, the schools are really good because, as you saw that one student there, her name was Susan, she's benefiting from it, as well as other students, because they have the mental health clinician right in the school. So what happens if they see a student that has a behavioral problem in the classroom, then that teacher knows how to let the guidance counselor know about it, and from there they take the person to the mental health clinician, who actually does a physical prognosis first, and then assess the student to see if they need help. And the other good thing about this program for students is that the parents also are part of it. Now, they have a separate program for parents as well.
Helps a lot for people to understand why a kid might be behaving in the way they do.
Absolutely, and you have to remember that they're coming out of the trauma of the Ebola crisis, and on top of being an adolescent and a teenager.
It can be difficult. Now, what is your biggest, greatest takeaway from your experience in Liberia?
I think for me, no matter who I talked with people from various sectors of society in Liberia. I talked with police officers, correction officers, teachers, mental health clinicians, and all of those people that went through the training said that it helped improve their lives. It made them more compassionate against people that have mental illnesses. It took away that stigma that many of them have, and even the clinicians who are trained medical professionals, they're midwives, they're RNs, they said it helped them to realize this person really has a serious problem that can be treated, and if they stay on the treatment, they can live a normal life.
Wow, great. Yes. Kim, thank you very much for your report and your insights. We do appreciate it. That's VOA reporter Kim Lewis.